Good evening. This is the International Health Policy Analysis for Egypt's Non-Communicable Diseases Policy. The Non-Communicable Disease Policy Overview. In 2004, the World Health Assembly requested that the World Health Organization to engage with civil society and with public and private stakeholders on global strategies on reducing the risk of non-communicable diseases. In 2011-2012, stepwise survey was conducted by the Ministry of Health and Population in Egypt with collaboration with the World Health Organization. The WHO stepwise approach to non-communicable disease risk factor surveillance provided an entry point for low and middle income countries to get started on chronic disease surveillance activities. The instrument covered 3 different levels or steps: a risk factor assessment with a questionnaire, physical measurements, and biochemical measurements. The study revealed a significantly high prevalence of risk factors to non-communicable diseases among the adult population, including a 24% prevalence of smoking and a growing use of tobacco. One of the most overweight populations in the world, with a 66% of women overweight and 42% obese, and almost 3/4 of the population not involved in vigorous activity, a 17% prevalence of diabetes, and a 40% prevalence of hypertension. There were 6 core objectives, which were to raise the priority in development and work at global and national levels and integrate prevention and control such as diseases into policies across all government departments, establishment and strengthen national policies and plans for prevention and control of non-communicable diseases was Objective 2, which Egypt has worked on, and a key achievement for them has been a development in a pilot project integrating non-communicable prevention, early detection, and management services to the primary healthcare level, including strengthening relevant referral systems. The success of this pilot initiative is now being rolled out to 17 primary health care centers across 8 governments. Objective 3 is to promote interventions to reduce the main shared modifiable risk factors for non-communicable diseases: tobacco use, unhealthy diets, physical inactivity, and harmful use of alcohol. Egypt has raised tobacco taxes and reduced salt and replaced trans fat in the Egyptian diet. Objective 4, to promote research for the prevention and control of non-communicable diseases. Objective 5, to promote partnerships within the prevention and control of non-communicable diseases. And Objective 6 is to monitor non-communicable diseases and their determinants and evaluate progress at the national, regional, and global level. The World Health Organization Global Action Plan developed a strategic non-communicable disease policy to attain 9 voluntary global targets, including that of a 25% relative reduction in premature mortality from cardiovascular disease, cancer, diabetes, or chronic disease by 2025. The main focus of this plan is on 4 types of non-communicable diseases: cardiovascular diseases, cancer, chronic respiratory disease, and diabetes, which make the largest contribution to morbidity and mortality due to non-communicable diseases, and its 4 shared behavioral risk factors: tobacco use, unhealthy diet, physical inactivity, and harmful use of alcohol. The plan goals are a 10% reduction in harmful use of alcohol, 10% reduction in physical inactivity, 30% reduction in salt and sodium intake, 30% reduction in tobacco use, 25% reduction in elevated blood pressure, 0% increase in diabetes and obesity, and a 50% coverage increase in drug therapy and counseling, and essential non-communicable disease medicines and technology with an 80% coverage. The plan recognizes that the conditions in which people live and work and their lifestyles influence their health and quality of life. The policy plan addresses the 6 identified objectives, which were supported by the Ministry of Health and Population, World Health Organization, and international partners. On August 21, 2014, in Cairo, Egypt, at a press conference, the Egyptian Ministry of Health and Population released a white paper entitled Framing National Health Policy. This addressed the commitment to the non-communicable disease health policy that was implemented in Egypt. The need for non-communicable disease policy initiative. The regional burden of non-communicable diseases continues to grow amongst individuals living in the Eastern Mediterranean region. Cardiovascular disease, cancer, diabetes, and chronic pulmonary disease accounted for 50% of all deaths in 2005. Globally, an estimated 35 million deaths related to non-communicable disease occur every year, representing 60% of all deaths, with 80% of these deaths occurring in developing countries. Approximately 16 million of these deaths occur among people under 70 years of age. The total number of deaths from non-communicable disease is projected to increase by a further 17% over the next 10 years. The World Health Organization estimates that the highest increase in the number of deaths will occur in Africa at 27%, followed by the Eastern Mediterranean region at 25%. Particularly when looking at Egypt, non-communicable diseases are currently the leading national cause of death. Non-communicable disease are estimated to account for 82% of all deaths in Egypt, and 67% of those are premature. Furthermore, one of the countries with the highest prevalence of diabetes as well as obesity in the world is Egypt. As noted in a recent study performed that indicated in Egypt 62.4% of women and 76.9% of men, for an average of 69.8, have a BMI that's greater than or equal to 25. It's also impacting children as well, for approximately 7% of children less than 5 years of age have been diagnosed as obese and have a 29% growth stunting. The cost of treatment for chronic non-communicable diseases can be devastating for people and families in the lowest income groups, and the behaviors associated with risk factors, such as tobacco use, they weigh heavily on family incomes. If left unaddressed, the economic impact of non-communicable diseases will be enormous to both the people and society. Therefore, Egypt has recognized the significant burden and negative impact on social and economic development and made positive progress through the establishment of non-communicable disease policy within the Ministry of Health and Population. Non-communicable disease has also contributed to a reduction of work hours by as much as 50%, leading to an estimated overall production loss of approximately 12% of Egypt's gross domestic product. The status in Egypt versus the United States. The status in Egypt has had incorporation of Project Hope, which is a group of individuals that address the rapidly growing risks of chronic disease worldwide, especially obesity, diabetes, and cardiovascular disease. And their primary approach is to increase the capacity of health professionals, healthcare workers, peers, and individuals to prevent, diagnose, and more effectively manage their disease. They also have had Egypt's Ministry of Health that has had training for employees and healthcare providers in which increased physical activity, counseling, precautions for patients with hypertension, obesity, and diabetes, and dietary counseling has been implemented. Installation of physical activity equipment in the health centers include treadmills, spin bikes, and recumbent bikes, and they've also developed walking groups and cooking classes. The National Nutrition Initiative had an Egyptian survey on diet, nutrition, and prevention of chronic non-communicable diseases that studied 6,018 adolescents, and 4,251 were assessed by measuring their fasting blood glucose levels. Noted with 404 adolescents with elevated glucose levels, they recommended school-based programs promoting healthy eating behaviors as well as increasing physical activity. The status in the United States has been developed on the U.S. structure, which includes Centers for Disease Control and Prevention, which works on global non-communicable diseases for the past 20 years through efforts that address disease surveillance and epidemiology, identify risk factors, and evidence-based prevention strategies using data to increase public health action and increase country capacity and skill development. The National Institute of Health conducts non-communicable disease research, including globally focused research as members of the Global Alliance for Chronic Diseases, and supports surveillance and training programs. The U.S. Agency for International Development emphasizes investments in health systems, strengthening with existing global health efforts. In a few cases, the agency was identified with cost-effective interventions to address non-communicable disease objectives. The Millennium Challenge Corporation is a U.S. government corporation focused on promoting economic growth and reducing poverty in low and middle income countries, and addresses non-communicable disease and creation in certain countries. There's been an increase in recognition of World Cancer Day and World Diabetes Day. New York has passed legislation to ban smoking and public access to reduce tobacco use and exposure to secondhand smoke. And there's been the new National School Lunch Program that has been implemented. The government legislative processes, Egypt versus United States. The Egypt government structure is a republic. The executive branch is noted with the chief of state and President Abdel Fattah al-Sisi since June 8th of 2014. The next election will be held in May 2018. The head of government is a prime minister. The legislative branch is a unicameral House of Representatives, minimum of 450 seats, with up to 5% appointed by the president, members to serve 5-year terms. The process for elected members, as stated in Article 102 of the 2014 Constitution, may be majority, proportional list, or a mixed system. The principal legislative body is also noted a mixed legal system is based on Napoleonic civil and penal law, Islamic religious law, and vestiges of colonial-era laws. The judicial branch is the highest court. Court of Cassation consists of a court president and 550 judges, organized in circuits with cases heard by panels of 5 judges. The judicial review of the constitutionality of laws by the Supreme Constitutional Court. The United States government structure is a constitutional democracy. The legislative process is comprised of the U.S. Congress, consisting of the Senate and the House of Representatives, and the judicial review is by elected/appointed Supreme Court. Support or resistance for the non-communicable disease policy. A significant limitation for the non-communicable disease policy is lower-income countries have decreased capacity for prevention and control programs due to the expense. However, there is a strong political commitment in Egypt, as well as the Egypt Ministry of Health, as they are aware that the support is crucial for the implementation to address the non-communicable disease crisis. Egypt has addressed modifiable risk factors such as tobacco, where they have raised taxes, enforced bans on tobacco, banned smoking in public locations, and provided smoking cessation programs. From excessive dietary salt intake, there has been regulation of salt concentration limits in processed and semi-processed foods. They've also reduced dietary salt levels through voluntary action by food industries. There has been an increase on taxes for alcohol. They've banned advertising and restricted access to alcohol. And they've introduced taxes on unhealthy food and provided subsidies for healthy food. A critical step in the fight to control tobacco in Egypt has been to reduce passive smoking, as it is a serious threat to public health, as well as those who do not have a choice in the matter, which include our children. Another support is the United Nations has made reduction in non-communicable diseases one of the United Nations Millennium Development 2015 goals. The impact of this support will support basic, clinical, and applied research, as well as multilateral efforts in collaboration with other nations. Pros, cons, and long-term implications. The stepwise survey results provided Egypt the opportunity and indication for a nationwide need to implement the non-communicable disease policy. The policy has been implemented in Egypt and will provide and improve health for all, as well as reduce premature mortality from the non-communicable disease. The incorporation of decreased tobacco use, increased physical activity, decreased alcohol consumption, and improved dietary habits will be beneficial for all. An analysis of the economic burden of non-communicable diseases in Egypt showed that people who had reported having non-communicable disease worked fewer hours, on an average of 22 hours less per week, which reduced the aggregate labor supply to 19% below its potential, leading to an estimated overall 12% loss in the country's gross domestic product. The movement toward reduction in modifiable risk factors will ultimately contribute to a labor supply that is able to contribute to increasing Egypt's gross domestic product. Greater advocacy is required to raise global awareness of this growing threat and to help dispel some of the myths surrounding non-communicable diseases. Non-communicable diseases can be prevented, and they affect not only high-income countries but middle and low-income countries as well. Preventing and controlling non-communicable diseases will require countries to strengthen their health systems, but the effort cannot stop there. A truly effective response will require action well beyond the health sector. Health practitioners, policymakers, community members, and industry leaders must work together in a multilateral fashion to create comprehensive solutions to this growing challenge.